Good morning, everybody. And welcome to the 4th Cardiff and the Vale Nursing and Midwifery Conference. I can't believe we're on number 4. Time passes, doesn't it? And the focus of our conference today is on delivering outcomes that matter to our patients. For those of you who don't know, my name is Ruth Walker, and I'm the Executive Nurse Director here in Cardiff in the Vale. I'm very proud to be that person standing in front of you today, because today we're going to celebrate the fantastic things that we do as nurses and midwives in this organisation. So we're desperately hoping that you're going to learn some new things, maybe get a flu jab. I've already had mine. Maybe meet the beauticians. Just get to talk to one another, that thing you don't do an awful lot of because you're all really busy. And generally have some fun, because that's what this is all about. It's about celebrating the fantastic things we do. Now, to begin, there's some practical things I need to tell you. We are not expecting a fire alarm today, but if we should have a fire, then you need to take the nearest exit and go down the stairs and out of the building into the main front entrance, and you will be directed by City Hall colleagues. You will also notice that in your lovely bags, I'm sure there's a study there about the colour of the bags and why you chose that colour, but that's for another day. And pink is good, somebody told me earlier. So in those bags is lots of information. You have the programme for the day, but it also tells you very practical things, such as where the concurrent sessions are and where the bathrooms are. So they are all vitally important. And the other thing that we're doing today is that we are on Twitter live. So behind me is the hashtag. You'll also see it on your table. How many of you tweet? So feel free to tweet. If you don't tweet, there's people in the room that can help you do that. We're very skilled in many ways. The tweeting bit isn't my skill, but there's other people who can do it. Because really we want our colleagues who are not able to be with us today to actually find out what's happening in this room so that we can share the knowledge. There's over 350 of you here, but we employ an awful lot more staff than that. About 7,000 nurses and midwives we employ in this health board, so we really do need to share the messages. So I'd ask you to do that, and I'd ask you to take that away. So let's have a little look at what we've been up to over the last 2 years when we last came into this room, shall we? So in the last 2 years, nurses and midwives have been caring in partnership with our patients for 280,000 people who've attended A&E, 1.5 million who've come to outpatients, 286,000 people who've been inpatients in our care. We've managed to reduce inpatient mental health beds whilst moving nurses into specialist community teams, a real driver for change for our strategy, but also for Welsh Government strategy. And we've continued as part of the 10-year plan to reduce from 7,500 to 30,000 increase in mental health referrals. Now, you'll all be aware that we're seeing more and more of the public recognising they've got mental health issues and coming forward, but our teams are coping with that really, really well. And we've seen way over 500,000 of our district nurses' visits in this health board alone in 2 years. And of course, we delivered quite a few babies as part of that process. So 12,000 babies, and I would imagine, Suzanne, a few more since we last did that, did this slide. It's always nice to see some babies at some point during the day. So that's an amazing achievement. We also protect our patients, and we've done that by doing over 2,000 referrals, 65 adult at-risk referrals. We've held 39 professional strategy meetings. That's when individuals who are in our professions, not just nursing and midwifery, but other professions, there's been an allegation that they've caused harm to a patient or a member of their family. We've identified 95 cases of FGM, much higher number than I thought we had recognised within the health board. We've held 54 Prudic meetings and we've identified 36 victims of domestic abuse, but that's only in 3 months. So this will give you some idea of the number of things that we are dealing with on a day-to-day basis as we safeguard our patients and our staff. And what do our patients think? So we've undertaken over 10,500 surveys, paper surveys. 88% of those patients that answered those surveys said that they ranked us 8 to 10%. Now, 8 to 10 in a survey that is 0 to 10, 10 being excellent, is fantastic. So that's 92% of our patients say that we are kind and caring to them. So that is amazing. You should be really, really proud of that, because I've seen many surveys in other organisations that do not have a satisfaction of that level. So even when we're working really hard and we may go away at the end of the day thinking, I could have done a bit more today, our patients seem to think we're doing pretty well. And these are some of the quotes that they make about us. I noticed that nurses were feeding patients who are too vulnerable to feed themselves. All staff have been brilliant, keeping us informed in everything that they're doing. The midwives have been excellent throughout my care, very supportive. All nursery nurses give me excellent feeding advice. And they're just some of many of the quotes I could have presented here today. Only 2 days ago did I have an email from a medical colleague who shared with me what a fantastic team she worked with and how great they were at pulling together under a very difficult set of circumstances to give patients the right care, staying on 3 to 4 hours longer on duty than they needed to, just to make that and do the right thing for our patients. And I think you will agree that this is a really good example of what we do. So on behalf of the board, I thank you, but I have to say, why wouldn't you want to work in Cardiff and the Vale? I mean, it's a great, great video, and this video was first played at our AGM because we wanted to demonstrate to the public what it is that we do. But I'm sure that every one of you in this room didn't realise that that was going on somewhere else in the organisation. Is that fair to say? There's lots of things we do that we don't necessarily know, which is why days like today are really important, so that we can share with one another what is going on in your part of the organisation and spread the good news. So one of the things that you saw in the presentation was the values into action, where we really looked at what it was that was important to our patients and important to our staff in relation to our behaviours and our core values. This was a key piece of work for us over the last 2 years, and I really wanted to demonstrate the importance of this work and how it aligns with our code of conduct. So there is nothing in here that you would not expect to be treated with that behaviour when you come into this health board, but also for you to demonstrate that behaviour to others. And I know that's really difficult when the pressure's on sometimes, but it's not at all unreasonable to be kind, caring, to be respectful of one another, but also to not tolerate it from colleagues. So please hear from me today that actually if colleagues behave like that, you need to take them to one side quietly and tell them this is not in line with the values and behaviours of the organisation. Because if we are going to get this right, we really are going to have to challenge too. So this work is evidence based on what you and our patients say we want. So I encourage you to do that. So back to some of the other things we've been doing over the last 2 years. Well, we trained 446 students. We went through some of the most huge pieces of change in relation to our governance as nurses and midwives that we've ever seen before, and that was around revalidation. And we have had 100% compliance with revalidation in this health board. That is amazing. And we haven't had to nag you half to death to do it. There's been moments when we've all stood there. How many of you revalidated? It's all right, isn't it? In fact, I quite enjoyed it in a sick kind of way. You know, sitting down, talking to somebody about my reflections, taking time to recognise the impact of the code of conduct. So this was really important, and I'm really, really delighted that you've taken to this well. And for those of you who haven't, it's okay. And the IT is not a problem, I promise you. But there's more change to come. So the NMC announced in June this year the consultation on the new education standards and proficiencies and medicines management for the NMC. We've consulted on that and we have commented as a health board, and we will have to see how that goes. We have a new Nurse Staffing Act. The Nurse Staffing Act came into play in April of this year, and we will be reporting publicly on what our staffing levels are on medical and surgical wards by April 2018. But it isn't just medical and surgical wards. In the last few weeks, the CNO has issued a new set of principles for district nursing. We will be reporting on those. And to follow that is our work on paediatrics, health visiting, and mental health. This will form an important part of our planning process, our IMT process, and we will need to ensure that we've got safe staffing levels within our clinical environments. As we alluded to in the presentation, we've done some amazing work on Project 95 and Project Switchover. As you will all know, we're becoming a rare breed as nurses, particularly, less so for midwives, but we're very valuable and there aren't enough of us. So we've had to do quite a bit of work to recruit people to Cardiff and the Vale. Less difficult for us than it is for others. So we're now at 90% of our registered nursing workforce are in place as permanent employees. That is much, much higher than anywhere else in the UK. We should be really proud of that. It doesn't mean that we're not going to stop and keep working on that. And I'm very grateful to Caris particularly and Jenny Palmer for the work that they've been doing to try and drive that agenda. We've also managed to switch off Thornbury. Hallelujah. So we have no high-cost agency nurses employed in this health board, and we have sustained that. That means we do employ agency nurses, yes we do, but they're agency nurses who are being paid what we are paying them. We're not paying a company an extra amount of money. We're increasing our numbers on the bank so that we've got a flexible workforce that can flex with us up and down as we need more staff. We're managing to fill the shifts to 90%. That's higher than it's been in a long time. And on the 1st of October, we switched off agency healthcare support workers. So we only employ healthcare support workers now via the bank. There's a few exceptions to that, but since we've put that in place, day 6, we have managed to sustain that. So no healthcare support workers via the agency. But most importantly, we've been able to provide high quality care whilst we've been doing that. And that's really important. This isn't, yes, of course we have a responsibility to reduce the spend. We are in a recession, in case nobody noticed. So that recession affects us, and we have a responsibility to spend public money wisely. So employing the right numbers of staff, but not paying them at high levels is the focus that we're trying to drive. And I'm grateful that we are able to do that. I don't underestimate in any way those of you who do in rosters and trying to manage this on a day-to-day basis, how challenging that can be. So thank you for continuing to try and drive that. And if anybody knows anybody who's a nurse that wants to work in the health board and meets our standards, we're always happy to recruit. So how many inspections have we had since we were last together? We've had 145 inspections. Overwhelmingly, we have found that our staff are kind and caring to our patients and to one another. There's some fantastic work doing around safety work, around handover. And the staff that we interviewed as part of those inspection processes say that they feel very positive about working in Cardiff and the Vale Health Board. Of course, we found things we need to improve, and they are medicines management, documentation, and our environments of care. I'm sure none of those are a surprise to you. And we've had 7 DECI visits. They're the visits to our clinical areas that are focused on the quality of care. HIW undertook those inspections, and the outcome was that they found us to be kind, compassionate, effective care delivered to patients. And they commented about how enthusiastic our staff were. But they also told us we've got a problem with documentation on environments of care. The other area that we have seen progress in the last 2 years is the work that we've been doing on healthcare support workers. So if you can see on the slide the 2015 number, you'll see how compliant we weren't in relation to the standards required for supporting and educating healthcare support workers. You can see below that the 2017 improvement that we've made in the last 2 years. This is a really important work because this allows us to develop healthcare support workers as an alternative route into registration so that we can grow people like me. I was a healthcare support worker, to become registered nurses. It's a career path, and we know that those individuals that we employ by that route often stay with us, and they're loyal to us as employers. So there's great opportunity now to start developing our healthcare support worker workforce. So that's the progress we've made on just a few things over the last 2 years. So what are we doing next? Well, I'm absolutely delighted today to launch the new nursing and midwifery framework for 2017 to 18. This is what it looks like, and it will be available soon. Now, you might say, well, what's all that paper then? Well, just to make it a little bit easier, we've given you one of these. So in your pack, you will all have one of these. This is our nursing and midwifery framework on a page. And not wishing to steal Sheila Harrison's thunder, because she's got a concurrent session on this afternoon, this framework aligns with the strategy that we have for the Health Board, but focuses on those areas that we are going to give priority to over the next 3 years. And we will be reporting back at our next conference on progress with these things. So we're launching this framework today. Each clinical board will have the opportunity to choose which one of these key areas they want to focus on first. So they may choose to do any of those areas as their first part of introducing the framework. So it may not be necessarily appropriate to be doing dementia in children and women, although you would see that of your gynae patients. You might choose something else within there, like nutrition and hydration, as your first step. So your clinical board nurses will be working with you as to how you implement each one of these, and we get consistency across the Health Board. But I would encourage you to go and see Sheila's session a little bit later this morning. The second thing we're launching today is the Read About Me. Now, the Read About Me you've also found in your pack. And the reason we've chosen this is that it is one area within the framework that we believe we need to focus on. Currently, the Alzheimer's Society tell us that 1 in 6 patients has dementia. The average age of a patient in UHW is in and around 82 currently. So the likelihood of a large number of the patients in UHW, which is an acute tertiary hospital, will have dementia. In our community, that is 1 in 6 of our neighbours. It's also 1 in 6 of us, okay? So look how many people, 350 people in the room. Whoever, Andrew from finance, that's probably, you could work out how many of us are going to get dementia. Whatever the number I want it to be, thank you. That's the correct answer. The point I'm making is this is going to affect us. It's affecting us in our work. It's affecting us in our private life. By introducing Read About Me and launching that today, we really want us to focus on understanding the patient, not the clinical condition. So the focus of this work is that we get the opportunity to understand the patient as they were. Flu vaccinations. I've had mine. How many have had their flu vaccination? Okay, we are aiming to get to 60 people having their flu vax today. That would be 10% of our audience. So I ask you please to have your flu vaccination. But also, just to sort of give you some other things you might want to do, we have beauticians here today. And we'll have a few surprises as the day progresses, which we'll tell you a little more about as we progress through the day. But, so just to conclude, I thought you might like to have a little look at some of our nursing and midwifery achievements over the last 2 years. Not bad for 2 years' work, is it? If we have the UK Midwife of the Year, in our presence. We have health heroes, we've appeared on the casualty set, we've dealt with all of those patients. You are amazing. Thank you so much. Now, let's not forget to tweet and tell the world how brilliant we are, because we're really not very good at that as nurses and midwives. We kind of hide it under a bushel somewhere. So start shouting about how brilliant we are, because we clearly are. And an example of brilliance is what I'm just about to share with you. In the past, we've begun our nursing and midwifery conferences with a patient story. But this time, we decided that actually we would take a staff story. So Jude Holden is one of our senior midwives, and she's going to tell you a little bit about her story in midwifery. Powerful story from Jude, reminding us of the importance of accountability and standards, and how actually, although sometimes that feels like it's a weight that we bear as professionals, what she's also telling us is that it's a perfect framework to help you grow and develop. And we've seen huge changes in midwifery supervision since we last came together. So she also talks a little bit about the importance of supervision. I'm really grateful to Jude for taking time out to do that presentation for us, and she's on her way to Zambia soon, so we wish her well on the next stage. And also, you know, it demonstrates, doesn't it, that we've got nurses and midwives here in Cardiff who are also making a difference across the world, which is fabulous. That's really good. Okay, mindful of the time and we need to progress, it's off to concurrent sessions now. So you will see in your pack a set of concurrent sessions. As you walk through these doors, people will direct you in the correct direction. You stay in that room for those concurrent sessions until you are guided back out for a quick grab of coffee and into the second set of concurrent sessions. And then I will see you back in this room. Thank you.